Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the 216th episode of the CodeCast podcast. My name is Terry Fletcher. So over the last couple weeks, we've had a lot of vaccine mandate chatter, and physician practices and facilities that have been doing everything they can to get staff and providers vaccinated in fear of losing their provider status with Medicare and their funds being interrupted, trying to figure out what the heck is going on. So we've had a couple of things happen, but first let me give you a little bit of a background because there's two different kinds of mandates, and I think everyone tries to bundle every mandate into one mandate because they both are issued from the federal government, but they are two in of themselves. So let me explain, and then I'll explain who must abide by them and where we are with the stays or with they've been put on hold. So let me give you the clarification first of all. The CMS Omnibus rule mandating vaccines for healthcare providers, that is basically through Medicare. So that is providers that Medicare can basically dictate what they do and don't do and hold their payment over them. But let's kind of take a look at that from a different perspective. So then there's the OHSA Emergency Temporary Standards, or what we call ETS, and that is also a federal mandate, and that's the one that requires the vaccine or weekly testing for businesses with 100 or more employees. That's the one you've probably heard talked about through CNN, etc. So here's where the news is. So the CMS Omnibus white paper that came out, that again is Medicare only. It's from the interim final rule. It applies to federal entities that are CMS-regulated health entities and is not tied to size, meaning it does not have the 100-employee threshold. So who are the responsible, or I should say, who does this affect? Who does this impact? Well, when you're looking at the Omnibus only, this is staff that basically Medicare can say, okay, you are part of our entity that is where we call facilities. They're certified, they're suppliers and providers. They're regulated under the Medicare Health and Safety Standards known as condition of participation and conditions for coverages. And so there's certain entities that are required under that. And we just want to make sure that you're understanding that there are certain entities that are not covered under that, including physician practices and private physicians, things like that. But if your physician goes to the hospital and sees a patient, well, hospitals are under that entity, if you will, and so they may have to be part of that regulated mandate. The other vaccine standard, the ETS, or Emergency Temporary Standards, the one that's for businesses, that's at the direction and executive order, again, of the Biden administration. But if you read the plain text details of this one, it's not just a mandate for the vaccine to keep your employment. It also says weekly testing or mask wearing for the unvaccinated. And then there's some language in there regarding the unvaccinated. For that part, should only be for exemptions. But that's not what it says. That's kind of the spirit of the rule. Well, we had a couple of stays, or basically an enforcement stop. On November 6th, the Fifth Circuit Court of Appeals issued a stay of enforcement for the OHSA ETS, which was temporary, but on November 12th, the Fifth Circuit entered an order enjoining OHSA from enforcing the ETS. So that was really a big deal. Now, circling back to the healthcare industry, who the Omnibus COVID vaccine mandates impact, there was a couple of questions, and Dr. Lee Fletcher, who's an MD, was on a call. He's the CMS Director for Clinical Standards and Quality, and he basically said, okay, so let's explain this a little bit more. So staff who have COVID-19 antibodies are not exempt from the CMS requirements if they're in one of the regulated centers or hospitals, etc. And so they said in explaining the reasoning behind that decision, the agency cited available evidence from the CDC and others indicating that the vaccines offer better protection than natural immunity. They also said that the Equal Employment Opportunity Commission has additional information about exemptions, and that's kind of what they're looking at as far as testing options. CMS does not have different requirements for current and new eligible staff members, so workers at all healthcare facilities included again in that regulation of covered entities or covered facilities. They're saying they must be vaccinated by January 4th, but I'm going to give you a new update. Just hold on. There is also no minimum number of employees that I mentioned. CMS vaccination rule applies to pharmacies that go on site to covered facilities. The requirement includes those who provide care, treatment, or other services for facilities and/or its patients via the contract or other arrangements. Staff who work in assisted living facilities are required to be vaccinated, even if they also work in a nursing home. So one of the facilities that is not regulated by Medicare is assisted living, because that's almost like an apartment complex that offers some medical services. But if there are staff there that also work in nursing homes, then yes, they have to be vaccinated, and if their residents are there. While CMS requirements includes ambulatory surgery center, again, it doesn't include physician offices, but if your physician provides care on site in an ASC, just as they do in the hospital, then the physician would have to be and staff would have to be vaccinated for those facilities that are under those regulations. Now, here is the current rule. They're saying that by December 6th, facilities have to have plans in place, so some kind of compliance protocol on how you will handle this mandate. And then by January 4th, they could face fines or termination of their Medicare contract if everyone's not fully vaccinated in these regulated facilities. And so here's where it gets very, very interesting. So the booster does not apply here. We keep seeing everything on the news about now we have a new variant, Omicron. Let's just face it, this is going to continue forever, it seems like, just because it's like the flu. It keeps, changing its profile because people have different immunities, different impacts to vaccines. And now we know that even being vaccinated, you can not only carry it, but you can still get COVID-19. So there's a lot of things that are happening within all of this that has now prompted a lot of legal challenges. So let me talk to you about that. So I mentioned about the temporary stay. Well, a federal court in Missouri issued an order on November 29th that halted the mandate in 10 states. And Judge Terry Dowdy issued a preliminary injunction to cover all U.S. states on November 30th. So the CMS mandate, and that's what I'm referring to now, would have required 10.8 million healthcare workers, including 2.4 million unvaccinated individuals, to become fully vaccinated or face penalties. But now that is not the case because of the stay. So they halted the mandate. And, this was an important halt. And again, I am not advocating either way for vaccines or non-vaccines. Everyone should know about me. I do not advocate for mandates. I'm fully vaccinated by choice, by my physician and my decision. And I put that out there only because I don't want to get hate mail here. But I just want to make sure that you're aware I don't like mandates for this, because when does it end? When do mandates end? When do they tell you have to do something else? And that's not the country we live in. And that's what this judge is saying, and basically came out and said that CMS needs to provide, clear and specific information, and also they're trying to figure out how to deal with the lack of staffing right now. So this would just completely, threaten the financial viability and threaten the ability of ASCs and hospitals to provide care to communities, and especially those communities that have, low income and at-risk patients. And jeopardize providers' financial viability. The federal judge also said that a government agency should not be able to mandate healthcare workers to be vaccinated. He was also doubtful whether a mandate by Congress would be constitutional. So make sure that you're really getting all of your reading for this, because this mandate is, there's no question that mandating a vaccine is possibly something that could, should be done in certain situations, but not in all situations. And that's where the judge stepped in and said, you're having people mandate this vaccine who are not physicians. You're having people that are basically politicians mandating this. And so that's where the constitutional situation comes in, and that's why the injunctions were being granted. And this is straight across the country. Now, what about the the other mandate when it comes to the ETS or the Emergency Temporary Standards with OHSA. Has that been halted? Yes. And so that's also been halted, and I've seen some employers back off from that. But here's the other thing to keep in mind. Just because these mandates have been halted, okay, it doesn't mean that private businesses still can't file their own policies. You could have private businesses saying that you have to be vaccinated, and then you've got to take it up with their personnel, that employer, and figure out if you want to pursue legal action. So this is where it gets a little bit dicey on what you can do versus what is mandated versus what isn't. But for right now, as of this podcast, which will air on December 7th, and I'm actually recording on December 4th, as of today, this has been halted. So both sides, both the OHSA for small business and also the mandate from CMS under the Omnibus Act. So what this basically does, just in a nutshell, is you don't have to be concerned right now about losing your Medicare status and Medicare payments if your staff is not fully vaccinated. Now, what CMS does still recommend, and actually strongly, and I would too, is that regardless of the status of vaccines for your staff, make sure that you're still following your safety protocols. You know, that's still out there. We still have the virus out there, and so you still want to have, your staff masked if you can, whether they're vaccinated or not, and they're inside, and also making sure that that precautions are taken as far as wiping things down and making sure that your cleaning service is really continuing their due diligence in making sure things are sterilized. So, I know a lot of practices use their staff to clean the office. I hope most practices have changed that and are now actually using a formal company, because if you ever get sued for that or not taking protocols, or if OHSA walks in for just that kind of safety, that is still in effect, then they're going to ask you, okay, who is your cleaning service? And if you say, my staff and a bottle of Pine Sol, you're going to get in trouble. So just make sure that you are still taking the safety measures. But I wanted to give you the update on the vaccines because, oh my goodness, talk about some of the false information out there. And I just didn't want you to have it. So it has been stayed. It has been preliminary injuncted, which means it's been halted. And we always want to know that, just because there are certain states that are saying it's still mandated, but the government says that, or the judges have come in and said it's not mandated. And so I know in Florida, for example, hospitals make mandate decisions amid state, against federal requirements. They're saying federal, that they've been injuncted, so you can't do that. And I know several other places have done that too, but unfortunately, the states, are saying we're going to do what we want, and you can't have it both ways. You can't say you want a state do it at once only when it suits your narrative. So it'll be really interesting to see what happens, because one of the things that came out that drive me crazy. So there was a statement in New York where their current governor said that the New York Department of Labor has issued guidance to clarify that terminated workers won't be eligible for unemployment benefits unless they are a protected class under the non-vaccinated status. And that, talk about getting a legal problem there. So, if you're terminating somebody who, and this is my argument, who has been on the front lines for 18 months and either did not get COVID or managed, if they did get it, after the 95 masks, after being protected when we didn't have a vaccine, and they came out of it fine, then in trying to force them to do something they didn't have to do before by taking care of the height of the pandemic, that's a problem. So that's where I think that this is going to become very, very, very interesting when it all kind of pans out. But just expect more and more legal issues to come out on this, because there are all different sides to this whole vaccine situation. And we just want to make sure that you're aware of the current situation. So anything that you've read in October or November, just know as of December now, those have been put on hold. Okay, that is actually going to be it for me today. I wanted to just give you that update, and because of the tone of the message and making sure that you're clear on it, I just didn't want to bring anything else into today's CodeCast podcast. But we'll be back on point next week making sure that we're looking at some coding, looking at some compliance issues. There's a lot out there, and we'll try to move off of this topic if we can. But everyone, hope you're having a good December so far. You're getting your Christmas or Hanukkah shopping done, and that you're having a good holiday season to this point. So everyone, make it a great day and a great week, and thank you for listening to the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.